Welcome to Doc Talk, where we talk about topics that our patients are asking about. I'm Dr. Elizabeth Sander, a board-certified general internist. I still remember getting a smallpox vaccine. There were kids that had chicken pox. We all had it. And these were not fun things to endure. Having chicken pox is it's very uncomfortable. Having it as an adult is even more serious. But, polio can be a devastating disease. And so I think sometimes people in 2026 forget or never understood how serious some of these illnesses could be. Before we had widespread influenza vaccines, we had epidemics. Thousands of people died. We don't see that now, so I think people are not as they don't have the same level of concern that maybe 20 years ago, 30 years ago people had. So influenza is highly contagious. That's why, if we have large communities of unvaccinated people, it becomes an epidemic. Pertussis and diphtheria, they are also highly contagious. Respiratory syncytial virus is contagious if you're in sort of a setting, daycare, school, senior living facility. Those are contagious. Pneumococcal diseases there's a whole host of pneumococcal diseases, and they cause mostly either pneumonia or meningitis, an infection of the lining of the spinal canal and brain. Those are fairly contagious. The only one that's not really, you don't catch from someone else is shingles. Shingles is, it's actually what's known as herpes zoster. That's its more formal name. And it's a reactivation of the chickenpox virus. So when you're a child and you have chickenpox, you have a limited disease or a limited period of time where you're sick for a week or so. The rash clears up, but the virus lodges itself somewhere in your spinal cord. It just, wherever it decides it likes to set up shop, it stays there, and it's quiescent. It just sits there and doesn't harm you. And for whatever reason, at some point in the future, it can become reactivated. And wherever in your spinal cord it is lodged, that area of your skin, whatever that's associated with, that's where you will get the rash. So you don't get it all over, you'll get it in one location. Like sometimes people can get it in their eye or their ear, or the chest is a very common place. I've had patients who've had it like in the perineum and the rectal area. And if you get it recurrently, it will always be in the same place because that's where it's located. I'm Dr. Elizabeth Sander for Doc Talk. Here's to your health.